My name is Esther Karanja, student at Nutrition and Dietetics Academy, undertaking a specialized course in nephrology, and today we'll be discussing more on body composition and how it helps us manage better patients, especially in renal units. Nutrition assessment is key factor in determining nutrition status of a patient, especially in chronic kidney disease. Among the nutrition assessment, we have anthropometry measurements, which are quite important, especially when it comes to body composition. Anthropometry measures, it's a quantitative measures of muscles, bones, and adipose tissues to assess the composition of the body. What is body composition? Body composition comprises of water, proteins, minerals, and fats. These are key, especially when it comes to patients with chronic kidney diseases, because it will affect their optimal nutrition status. When it comes to body composition, it gives us a critical nutrition status of the patient. Body composition is divided into two, that is, fat component and non-fat component. Total amount of body fats consists of essential fats, which most of the time they become cushion to the things like organs, heart, and we have the storage fats, which among the storage fats we can have visceral fats, which is bad fats. How do we determine body composition? We have different methods of assessing body composition. We'll just mention but a few that will help us determine bone, fat, and muscles in our bodies. What do we mean by that? When we do like skin fold, which is a technique of punching the skin, which are used with a caliper device to measure the thickness of the skin fold for each side. Each protocol has specific sites to test, spread across the body, commonly including the chest, arm, abdomen, and thigh. The figure we get, I tell us about the fat composition of the body. This can help give us the outcome or an implication in terms of, is the patient obese, is the patient malnourished, or the patient wasted. Another form of assessment is BIA, bioelectrical independence analysis, where advice with tiny electrical impulses pass through the body, and depending on the thickness and or how quick the electrical impulses passes, it gives us the difference in terms of fat, because you find that it's easier for the impulse to pass through muscles rather than fat. And depending on the outcome, it gives us the nutrition status of the patient. We'll discuss further, or we'll dwell more on BIA because it gives us including the bone mass, muscle mass, body water in percentage. It gives us daily kilocalorie intake. Again, it gives us muscle mass and body fat percentage. This will help us so much when it comes to calculating or determining the energy in terms of protein, fats, and even the exercise the patient, especially in renal, is supposed to use. Number 3, in the method of assessing body composition, we have the X-rays, the DEXA, which an X-ray is passed through the body and give us the measurements of bone mineral density, lean body mass, and fatty mass. The last assessment I want us to talk about is waist circumference. Waist circumference is where we take a tape measure and then around the abdomen, in the level of the bell button, it gives us a figure. And for a female, the waist circumference is supposed to be between 80 and 89. And for a male, between 90 and 98. This, any moment that we find that the waist circumference is large compared to the normal, it tells us the risk the patient is in terms of nutrition status of the same patient. Now, okay, today we'll deal more on bioelectrical independence analysis, because it gives us a lot when it comes to a lot of information when it comes to nutrition status or body composition of a patient, especially in renal units, where a patient has to be calculated specifically or precisely the amount of protein, energy required by the patient because of the toxicity or the metabolic waste that the same food or the muscle supposed to remove. So let's discuss into detail body composition in relation to chronic kidney disease. You find most patients with CKD, they'll either be obese or they'll have muscle wasting. That's why we say when we do body composition, it will give us a precise nutrition status of this patient. And we know that this outcome, either obesity or muscle wasting, will have a direct or indirect implication on the survival, the physical outcome of the patient. Visceral fats has been shown to have a negative correlation with the serum adiponectin concentration among patients treated with hemodialysis or peritoneal dialysis. According to Zokal et al., observed that waist circumference modify the relationship between serum leptin concentration and cardiovascular mortality. What does this mean? It means that when the waist circumference, as I said earlier, it's bigger than the normal, you're at risk of getting cardiovascular diseases. That's why we have to make sure that we get proper assessment with our patient when we're in contact with them, so that we can ascertain or we can be able to note at what risk are they predisposed in terms of cardiovascular diseases. Another thing we talked about was bone mass. You find that bone mass tell us about the mineralization of the bones, especially when it comes to calcium and phosphorus. You find that when your bone mass is smaller to weight volume, you find that you're at a risk of things like 1, osteoporosis, 2, we have risk of breakage. Now, what we mean when you get your bone mass, you are able to advise the patient accordingly in relation to nutrition and phosphorus intake or calcium intake. What I mean is bone disease or bone mass will be able to direct us how low or high the calcium and phosphorus of a patient is. And this we can correlate with the lab works and help us to advise our patient accordingly. When we're dealing with body composition in relation to BIA, you'll find that it will tell us about metabolic age. What is metabolic age? Metabolic age is calculated by taking your basal metabolic rate. You compare with the average metabolic rate. This will tell us how many calories your body burns while at rest, or how efficient you're burning calories you consume. Now, this gives us, now when your metabolic age is lower than your age, it tells us you have a good health, or it tells us you're burning more calorie in the food you're taking. Now that's good, but again, it doesn't have to be too low, because you find that most or common problems we find in renal is catabolism. And now that gives us an indicator, or actually the bone age, the metabolic age is supposed to be slightly low or normal to your age. Now we find when it's too low, you have to increase your energy intake, because now it will tell us that your body is burning more energy than you're taking. Body water. What about body water? You find that water has a lot of functions in the body, and you have critical or crucial when it comes to fat metabolism. You find that normal body water, or a healthy body water for a female, should be ranging between 45 to 60%, while in male range between 50 to 65%. You find that when your body water is too low, meaning things like excretion, even the excretion of the waste product or metabolic or muscle wastes, metabolic waste become compromised. And patient with kidney problems, we find that one of the risks is removal of the metabolic waste. So that has to make sure that our body water is adequate so that you will be able to transport nutrients, remove waste, cool body, and that will be very, very critical when it comes to patient in renal units, especially when they are not undergoing dialysis, because it will tell us how good the waste is being excreted. Earlier, we discussed or said that patients with chronic kidney disease, they undergo what we call muscle wasting. You find that when we lose muscle or fats, it's very critical to do body composition. Why? You find it tell us the range so that you can be able to calculate or up or reduce your body fat. Especially when you find that your body fat is too high, another thing you can correlate with is lipid profile. Will tell us how predisposed you are to cardiovascular diseases. Now, this is very, very important, especially to patients with kidney disease. A normal range or a healthy body fat for a female ranges between 18 to 24, while for male ranges between 6 and 15. You find that when body fat is less than 5 in males and less than 8 in females, you will find that this we call it's too lean, which is not acceptable. Again, fats less than 25 in male and 32% in female, that is body fat. This is an indicator that we are obese. Especially now we have to put measures to make sure that the patient comes to ideal body weight. We have different ranges when it comes to body fat between male and female. Male generally are supposed to be leaner compared to females, though we have a difference or ranges where it's acceptable or not acceptable. What do I mean? I mean that acceptable ranges is, are you normal, are you over, or are you under fat? Because the leaner you are, or it's because one of the things we said about fat, we have essential fats. When you have too little fat, again, it compromises the absorption of minerals. I mean vitamins, because we have what we call fat soluble vitamins, and that can lead to a very serious complications when it comes to patient with kidney disease. What are the acceptable ranges between the female and male? What do we call excess body fats in male is anywhere between range of 21 to 30%, while in female ranges between 31 and 40%. Moderate lean is in male 13 to 20%, while in female between 23 to 30%. Lean or acceptable or normal range for male is between 9 to 12%, and in female between 19 and 22. Ultra lean is between 5 to 9, and that's for male, and for female between 15 and 18. Extremely thin is less than 5% in male and less than 15 in female. This will help us when it comes to calculating the energy requirement of a patient, because it gives us a direction or something to lean with or to reference with. When the fat is too high, again, what you really need to look at in correlation with the lab works is lipid profile. Because you find when the fats are too high, you're at risk of cardiovascular disease. That's now tell us how important nutrition assessment is. That's in relation to anthropometry measurements actually is in each and every patient, especially in renal units. In conclusion, nutrition assessment, especially anthropometry measurements in relation to body composition, is very key in intervening and monitoring of patients in renal units, because it gives us a direction or a key point when it comes to meal planning, nutrition education, and even nutrition advice to patient. Because as we have seen, it deals with all aspects of the body. That is our calcium levels or our body mass, our muscle mass, our fat percentage and water percentage, even the daily kilocalorie. So kindly, when you're managing the patients, let's make sure that each and every patient we come across or contact with, let's take a comprehensive nutrition assessment, and that includes the body composition, because it will help us manage these patients. Thank you.